manage finances, then you cannot support the health services that Australia needs. You can have all the best intentions in the world. You can have all the great ideas. But unless you're actually running a strong economy, then you can't fulfil them. One of the hardest things that Greg and Anne and I have to do, Anne in the social service policy area that she's worked in, and indeed I've worked in the past, Greg, Health Minister for many years, is the number of needs that are there in health. And that's why we are just so committed to ensuring that we keep our economy strong, that we keep managing our finances well, because only that way can I look the young people that I have just met in the eye and tell them we can do what we're announcing today. It means that we've been able to lift the Medicare bulk billing rate to 88.8% from 82.2%. It means that we've been able to deliver 100 million telehealth services. It means we've been able to double the funding for public hospitals from $13.3 billion to $27.2 billion. It means that we've been able to guarantee Medicare. In fact, I was the Treasurer who introduced that, guaranteeing the Medicare and the PBS bills to ensure that we could support those very important programs. It's important that we can support Medicare, which has a budget now of well over $30 billion. It also means that we can have been able to support 2,900 additional and new listings on the pharmaceutical benefits scheme. It means that we've been able to double funding for mental health in this country, around $6.7 billion now. And we're able to make important announcements, most recently, where there isn't Head to Health, but on early psychosis for adolescents, and ensure that they can have the hope of a life which is free from the difficulties of mental health as much as is possible. So all of this has been made possible because of strong economic management. That's why understanding the economy matters. That's why having a strong economic plan matters. That's why having a strong economy matters, because if there isn't, and you can't manage the budget, well, you can't do the things you want to be able to do to guarantee the essential services, especially in health, that Australians rely on. But when you can do it, when you can manage a strong economy, then you can provide this support. And that's why today I'm very pleased to be making this very important commitment. And I'll ask Greg to go into more detail. And that commitment today is to commit $273.1 million to expand the CGM initiative, that is the Continuous Glucose Monitoring Initiative for diabetes. Now that will mean that every single person who has type 1 diabetes will have access to that scheme. It's an extra 71,000 Australians who will get access to that from the 1st of July of this year. That means that there's 130,000 Australians who do suffer from this condition. They will have access to the life-saving CGM device, and you would have seen it on the young people particularly who are joining us just down below the stairs there. And that can cost up to around $5,000 without subsidy, depending on the device that they're actually using. And so under these changes, we are enabling that to be accessed by everybody. And it means a quality of life that many of them would never believe they could have had. That's what the advances in this medical technology are doing for people. Can't always cure the condition, but you can ensure that people have a quality of life they weren't otherwise able to enjoy. And so by being able to make this commitment today, I'm really pleased, particularly for those younger people who are going into adulthood, and they'll be able to get access to these devices and it'll be able to support them. In addition, today we're making some announcements, and I'll ask Greg to go through these in greater detail, but it includes another round of medicines to be listed on the pharmaceutical benefits scheme, one for prostate cancer, another one for relapsed or refractory multiple myeloma. And in addition to that, further funding out of the Medical Research Future Fund that is enabling new advances, particularly in how we're managing demand and tackling problems around the country for dealing with pain management and emergency management in our hospitals. But all of this is made possible, as I said at the outset, by ensuring that we have a strong economy. And that's why our government will always be so focused on that as our top priority. If you run a strong economy, you can guarantee the essential services Australians rely on. If you can run a strong economy, you can keep Australians safe, and you can invest and rebuild our defence forces, as we have. If you run a strong economy, you can continue to support community organisations at the heart and soul of our community. So it is a happy Easter today if you've got type 1 diabetes. It's a happy Easter because of the commitment that we're making today. And I know that people from all around the country will be able to look forward to a better quality of life as a result of the fact that they live in a country where there's a strong economy and a government that knows how to manage Australia's finances. Greg.
Thanks very much to the PM, to Minister Anne Ruston, to Maria Kovacic, our candidate for Parramatta, and to the whole of the diabetes community that's represented here today, represented by people such as Holly and Kieran, our beautiful young children, and then our older Australians such as Tegan and Justin and so many others. These are the people that will benefit from continuous glucose monitoring, something that's only possible when you do have a strong economy. One of the privileges I have had in my time is a Prime Minister, a Treasurer, a Finance Minister, a Social Services Minister who've been supportive of these investments into health. And so today we're announcing the third stage of our continuous glucose monitoring program. We announced CGM for children under 18 initially, and for pregnant women. We expanded it to 21 years of age and concessional card holders. Now we're making it universal, and it's $273 million, but it's not the money. It's the access, and as so many said to me, the certainty of peace of mind now and the certainty of access throughout their lives, no matter what their circumstances, to the latest technology. So there are 130,000 type 1 diabetics in Australia. Every one of those will now have access to this life-changing, life-extending, quality of life improving and potentially life-saving technology. And it's a privilege to be able to do this on our watch in our time. In addition, new medicines on the Pharmaceutical Benefits Scheme from the 1st of May. Early-and for prostate cancer. 1,000 Australians will benefit from this medicine, which will save them up to $40,000 a year. Implicity, in particular, for multiple myeloma. And what that means is that for just over 200 patients, they will have access to a medicine which could save their lives, extend their lives, improve their lives, which would otherwise cost $145,000. $145,000 to as little as $6.80. That's what a universal healthcare system is actually about, and that's what a Medicare and PBS guarantee is about. And then finally, I'm really pleased at the medical research to bring new medicines and new treatments for diabetes and so many other things, $170 million, including $9 million for participating in international clinical trials in areas such as stroke management and atrial fibrillation. So it's an important day, and I'm privileged to be able to announce it and also to introduce my friend.
Hang on a sec.
Yeah.
I have an important announcement I've got to make first. I thought I would leave that. Thank you, Greg. And I do want to thank Greg Hunt, not just for his contribution here today. Greg Hunt, I believe, is the finest health minister this country has ever had. As we've gone through one of the most difficult time from a health perspective in 100 years, a 1 in 100 year pandemic. And I couldn't have hoped to have had anyone of greater intellect and greater compassion than Greg Hunt by my side as we've navigated our way through, saving tens of thousands of lives, achieving one of the highest vaccination rates in the world, keeping our economy going through all of that. It has been a tremendous partnership to have Greg as part of that senior cabinet team. And it's important, I believe, as we go to this next election, as I flagged to you earlier in the week, that Australians know in these key portfolios, obviously in health, obviously in defence and foreign affairs and treasury and finance and so on. These positions are very clear. But with Greg's retirement at this election, I said I'd make it very clear who our next Health and Aged Care Minister would be if we were successful at the next election, and that will be Minister Anne Ruston. Anne, I promoted into the Cabinet as Social Services Minister. I also brought her into the Budget Committee, the Expenditure Review Committee. Anne has demonstrated the stakeholder management, the financial skills, but most important, having a big heart to be able to deal with the many issues that you need to deal with in the health portfolio. She's demonstrated that in the social services portfolio. She's worked with people all over the country. And the other thing that I'm very pleased with bringing Anne, hopefully, into this portfolio, should be successful at the election. She comes from regional Australia as well. And in the policy that we're now outlining today, there have been significant investments in regional health. And I think Anne will bring all of those skills to this job, and I think she'll make a fine successor to Greg should the Australian people choose to return us as a government on the 21st of May. And with that, I'll ask Anne to say a few comments.
Thanks very much, Prime Minister, and it is an absolute honour to be named the next Health Minister should the Australian public honour us with returning us to government on the 21st of May. It's a huge privilege because I follow in big footsteps and big shoes in following from Greg Hunt, a man who I think will be recognised into the future as probably the greatest health minister this country has ever had. I certainly, Greg, look forward to spending the next 5 weeks picking your brains to make sure I can get everything I possibly can from you about health policy going forward, because you are an absolute encyclopedia. I particularly look forward to building on the great successes that Greg has had. Three that stand out more than anything. One of them today, is about making sure that we get access to affordable medicines and affordable healthcare to Australians. His absolute commitment to mental health, it goes unquestioned, as well as his commitment to the investment in medical research, which we know goes such a long way to make sure that our health going into the future is something that's going to be able to continue to respond to the needs of all Australians. But as the Prime Minister said, having a great passion for rural and regional Australia, have lived most of my life in rural and regional Australia, I'm really pleased that the budget that we brought down a few weeks ago recognises the importance of rural and regional Australia by nearly $300 million, specific new investments into rural and regional health to support our 10-year Stronger Regional Health Plan. Initiatives like making sure that MRI rebates are available in rural, regional and remote communities, making sure that we have got more doctors being trained in rural and regional areas, because we know doctors trained in rural and regional areas are more likely to stay in rural and regional areas, and of course the absolute much-loved Royal Flying Doctor Service, a continued investment to make sure that those people that do live in remote communities can have the confidence and the certainty that they will be able to access our universal health system as well. So it is with a great honour to be able to be named the next Health Minister should we be successful in winning the next election, and I really look forward to working with the team, but also working with Greg over these next 5 weeks to make sure that I can gather as much information as possible, and I very much look forward to serving Australia.